The group is called Going for Goals, but based on dialectical behavioral therapy for adolescents. I'm associate professor in the Department of Psychology at IUPUI, and my research focuses on developmental risk and protection of substance use, particularly during adolescence, and also focusing on racial ethnic minority youth to understand cultural factors related to substance use. If we can intervene early for those that are going to possibly be at risk, we can offset some of the problems that they might see later on. We know that adolescence is the time when people start to experiment or engage in substance use. We also know that the earlier someone starts to use substances, even if it's experimental, increases the risk for continuation of substance use. So early intervention, early detection is really crucial. We've been working with Ben Davis now for a few years. We have between 10 to 15 students, and it's a brief 9-week intervention that's focused on 4 main areas: mindfulness, emotion regulation, distress tolerance, how to tolerate stress and difficult situations, and interpersonal effectiveness, being able to communicate what you need to others. And as it's grown, other kids are talking about, students are talking about it to their friends, the teachers are noticing changes.
It's very important that we give the students tools to succeed when they're faced with being exposed to substances. A lot of them, unfortunately, have substance abuse in their families, and so it's a little bit more difficult sometimes for them to not go down that path. It's been great. The data that they've shared with us has shown that some of them have used less.
I hope for these kids just to be able to be successful. I know from talking to kids that they're stressed out. There's a lot that they have to deal with, both in school and outside of school. And so to be able to give them skills to feel more confident, to feel that they're not alone. Specific skills, so mindfulness, how to be